Anthelmintics are a group of medications used to treat intestinal and systemic parasitic worm infections, such as those caused by pinworms, tapeworms, and intestinal flukes. The most commonly used anthelmintics include albendazole, thiabendazole, ivermectin, praziquantel, diethylcarbamazine, and parental. These medications are taken orally. Once administered, anthelmintics act in parasitic worms by disrupting metabolic pathways that are required for their normal functioning, ultimately killing the worm. As far as side effects go, these are typically very few and limited to the duration of treatment. So, clients might experience headaches, drowsiness, dizziness, and weakness. In addition, anthelmintics may often cause gastrointestinal disturbances such as anorexia, nausea, vomiting, diarrhea, and cramping. Finally, some clients may develop a skin rash or urticaria. Now, anthelmintics are contraindicated during pregnancy and breastfeeding. Additional precautions should be taken in clients with severe diarrhea, malnourishment, and hepatic or renal disease. Alright, when a pediatric client is diagnosed with a pinworm infection caused by Enterobius vermicularis, they can be prescribed an anthelmintic medication like albendazole. Before administering the medication, be sure to perform a focused assessment, including their current weight and a description of their symptoms, such as the presence of erythema or excoriation, itching in the perianal area, a report of restless sleep due to itching during the night, as well as irritability and loss of appetite. Then, review their most recent laboratory test results, including CBC, renal, and hepatic function tests. Lastly, review the results of the cellophane tape test confirming the presence of pinworm eggs. Then, explain to the client and caregiver that pinworms are a common intestinal infection, especially in children, and assure them that albendazole is effective in treating the infection. In addition, be sure to explain that the infection is easily transmitted, so all members of the household will need to be treated at the same time. Next, let them know the treatment consists of just 2 doses administered 2 weeks apart, and emphasize the importance of completing the full course of medication in order to completely eliminate the parasite. Advise them to take the medication on an empty stomach, and let them know that the pills can be crushed or chewed and followed by a glass of water if needed. Also, alert them to the potential side effects like headache, abdominal pain, nausea, and vomiting, and prompt them to contact the pediatrician should these symptoms not resolve. Next, teach the client and caregiver about lifestyle modifications they'll need to make during treatment. Emphasize the importance of scrupulous hand hygiene, especially after using the bathroom, changing a diaper, and before eating or drinking. Be sure to remind them how to prevent the spread of infection by avoiding touching or scratching the perianal area, as well as helping the child to keep their fingers out of their mouth and keeping the child's nails trimmed short. Other preventative measures include cleaning pajamas, bed linens, and underclothes daily in hot water, showering rather than bathing, avoiding co-bathing, and frequently disinfecting toilets, sinks, handles, and toys. Lastly, let them know that the child can continue to attend daycare or school during treatment, and remind them to inform the school nurse, as well as the child's teacher or daycare staff about the child's infection and treatment. Finally, throughout treatment, monitor for side effects. Make sure that the client and household members complete the 2 doses of albendazole required, and assess for the therapeutic effect of eradication of the pinworm infection, as well as resolution of the perianal itching, return to normal sleep patterns, as well as prevention of infection spread and absence of reinfection. Alright, as a quick recap, anthelmintics are a group of medications used to treat intestinal and systemic parasitic worm infections. The medications work by disrupting the worm's metabolic pathways, disrupting normal functioning, and ultimately killing the parasitic worms. Side effects include headache, dizziness, gastrointestinal upset, and sometimes rash or itching. Anthelmintics should not be used while pregnant or breastfeeding, and should be used cautiously in those with severe diarrhea, malnourishment, and hepatic or renal disease. Nursing considerations for clients prescribed anthelmintics include thorough education regarding lifestyle modifications for infection control and prevention, as well as monitoring for side effects, eradication of the infection, and the resolution of symptoms.